Good morning, everybody. We are live, Mark tells us. Some of us, I'm poking myself, make sure I am, but I think I am. Welcome to our breakfast briefing this fine September morning. Feels like fall out there. This briefing is sponsored by Von Vriesen and Roper. Jim Macy and John Iden are with us again. Thank you, gentlemen, for joining us. Got a good turnout today, which is good to see. Something we're going to be doing every month, throughout the fall and winter, and at some point we'll even get back together. I'm guessing. So we are having today. The topic is updates on FMLA and the ADA in the Corona-19 environment. So I think we're going to kick it over to Jim in 2 seconds here. I know. Anybody can ask a question, so just submit your question in the Q&A tab on the bottom of the screen, and I think they'll either answer them as they go along, or they will. Jim and John will take care of them at the end of the session. So with that, Jim Macy, take it away.
Thanks, John, and good morning, and thanks to the Chamber for continuing this program of employment updates that we've been doing. We look forward to the time, John, not only that we can get together again, but also that we can talk about something that doesn't have COVID-19 in the title. But the reality is that, since February, since March, a day doesn't go by that we don't seem to have some new nuance or some new challenge or change in regards to what we're seeing with this. As many of you know that are participating in the program today, we regularly, annually do an update on FMLA and the ADA, the new pieces that we see with that, the changes. And it certainly has changed and has different nuances with the overlay this year with the Families First Coronavirus Act. John's going to talk about in a little bit. I know we've talked about it before, but we're going to talk about it a little bit different today with the overlay that we see with the other pieces going on, and then the practical things that you're seeing every day and the problems that we're addressing to help all of you through those things. Hopefully you don't see them. If you do see them, this might tip you off to where some red flags are and how to handle some of those situations as we go. So without any further aspect to this, John Iden, first of all, I want to introduce John. He's a regular with these programs, one of my partners, one of the shareholders at the law firm. John, any intro comments you'd like to make before we get rolling other than that? And with that, then I turn it over to you as well.
Yeah, no, I think we're ready to get started. As Jim said, this presentation is going to focus on a variety of leave laws and considerations that you should have as you navigate employee absences. We are going to start with a discussion of the FFCRA, the Coronavirus Response Act, which was passed back in, I believe, late March and went into effect in early April. We received guidance from the DOL in April, and I know a lot of employers have navigated that, implemented policies, and are fully up to speed. But Jim and I are seeing in our experience that there's also a fair number of employers who have gone 3, 4, 5 months without an exposure. They helped employees navigate the school closing at the end of last year, haven't had any COVID cases or exposures, and are now seeing some leave or attendance issues due to what's happening in school districts and the changing plans with schools, and also the fact that as more time goes by and people return to normal lives, we're several months removed from the shelter-in-place order or safe-at-home order, more and more employers are seeing cases and exposures and dealing with quarantines. So it's a good time for a reminder on what the FFCRA provides, how employers need to compartmentalize the Emergency Paid Sick Leave Act from the Expanded Family Medical Leave Act, how those leaves interplay with, as we have here, the ADA, workers' compensation, short-term, long-term disability, and then whatever policies the employer has in place, your leaves of absence, your sick leave policy, your paid leave policy. So with that as background, again, I just want to briefly kind of summarize the key aspects of the Families First Coronavirus Response Act. Again, this is that spring 2020 legislation that included the expansion of FMLA rights, the emergency paid sick leave component, and then at that time it also included increased unemployment compensation benefits and a relaxed unemployment eligibility standard. In my experience and what I'm hearing from employers, the eligibility criteria remains relatively lax as far as the distribution of benefits, but I do believe that the increased benefits have sunsetted. There's been discussion about reinstituting an increased benefit. I don't think any legislation has been passed to that effect, but for purposes of this presentation, we're going to focus on the expanded FMLA and the emergency paid sick leave. So the Expanded Family Medical Leave Act, this is another way for employees to access the 12-week leave benefit under traditional FMLA. So employers who have more than 50 employees are very familiar with traditional FMLA and the eligibility criteria for the employees, how long they have to work. There's both a time duration as well as an hour requirement for traditional FMLA. So the concept of covered employer, covered employee, and qualifying event is, again, familiar terminology with those in the HR role who are dealing with employers covered by traditional FMLA. It's a foreign concept for employers with less than 50 employees, and especially foreign concept for someone who doesn't have a full-time HR professional. They are now wading into this area of benefit distribution and administration without having, again, that background in traditional FMLA. But what the expanded FMLA provided in the FFCRA is another way, is a relaxed eligibility standard for employees, broadens the coverage for employers, and then set a new qualifying event. So to go through those three components, the definition of eligible employer under the expanded FMLA Act is an employer with less than 500 employees. So it's obviously significantly broader than the 50 employee threshold, and obviously capturing a lot of the smaller employers who were previously exempt or not covered by the traditional FMLA. The employee eligibility criteria under traditional had to be employed for a year, had to have worked at least 1,250 hours. So short-term employees, as a general rule, aren't entitled to traditional FMLA. Now with the expanded FMLA, employees only have to work for 30 days in order to be covered by the expanded FMLA, and there's no hour requirement. So you have a part-time employee who's been employed for 30 days and only works 10 to 15 hours a week, they will be covered by the expanded FMLA. And then what is the qualifying event for the expanded FMLA? There is only one. The single event that qualifies an employee for expanded FMLA is a need to provide child care due to school or daycare closure related to COVID-19. So if you remember, back in the spring, schools go virtual, a lot of daycares were closing, and if your school closed or your daycare closed and you as a parent needed to miss work, you could not work or telework because of the need to provide child care, you were eligible for the expanded FMLA benefit. Now again, it's important to remember that this benefit is an alternative way to access the traditional 12-week FMLA benefit. So if you are an employer covered by traditional FMLA, you need to simultaneously track traditional FMLA usage along with expanded FMLA usage. If you're below 50 employees and you're only covered by expanded FMLA, you only need to focus on providing up to 12 weeks of leave for child care due to school or daycare closure. The analysis is a little more complicated and nuanced if you're over 50 employees in simultaneously administering traditional and expanded FMLA. So for example, you have an employee who went out for a knee surgery this summer and used 6 weeks of traditional FMLA due to their own serious health condition. Now they have a child who's not allowed to go back to school, or their school district has gone all virtual, so they're asking to use expanded FMLA. Well, they're drawing in those two events from the exact same bucket, for lack of a better word, of leave. They're drawing from the same 12 weeks. They've exhausted 6 for the knee surgery. Now they only have 6 available to them under the expanded FMLA. So again, another nuance or layer for those of you who are simultaneously dealing with traditional and expanded FMLA. The expanded, as we all know, the traditional FMLA leave benefit is unpaid. The expanded FMLA benefit for childcare due to school or daycare closure is again a 12-week benefit, with the first 2 weeks or 10 work days being unpaid, and the remaining 10 weeks, or the remaining amount of necessary leave, being paid at 2/3 the employee's regular rate. And this is basically 2/3 what the employee would have been earning had they been working. So if they're a full-time employee, it's 2/3 their full-time schedule. And if they work a flex schedule, or if they work an inconsistent schedule, you would look over the course of the past several months to determine an average of hours worked on any given day, and it's 2/3 of that at daily average hours worked. You're just trying to provide them 2/3 of what they would have earned had they continued working during the leave period. And there is also a wage cap under the expanded FMLA. So the verification of need, this is a very detailed process in traditional FMLA, requiring documentation provided by a healthcare provider to substantiate the need for leave. In the expanded FMLA, the employer still has the ability to require documentation verifying the need for leave. And again, expanded FMLA, there is one and one event only, that is school or daycare closure. So when we're talking about expanded FMLA, we're not talking about quarantine orders or doctor's notes or seeking diagnosis because you're experiencing symptoms. That's not expanded FMLA. So when we're talking about verifying the need for expanded FMLA leave, again, you're verifying the names and ages of the children. More importantly, the school district where the child is enrolled. And maybe 6 months ago, that would have been fairly self-explanatory. The enrollment outside of school districts hadn't been changing much pre-COVID. I can tell you now, in the last 6 months, we've been seeing a lot of changes to kind of the traditional public school enrollment in your local district. We have seen other districts with increased enrollment outside of districts due to the model that they've implemented. We've also seen an increase in enrollment in private school districts that, again, have a model that's more appealing to parents. So you just want to make sure that you're verifying the school or daycare where the child is enrolled and that has closed. And then finally, you want to verify that the employee is needed to provide leave, needed to provide childcare. The leave is needed to provide childcare. And the need component is kind of the opportunity for the employer to explore whether or not there is another, if the spouse or if there's another parent in the home that is also taking FFCRA leave for childcare. You could certainly ask and explore whether someone else is available to care for the child. The DOL guidance states that the employee has to be unable to work or telework. You can have a conversation with the employee about whether they can work a reduced schedule from home, telework a reduced schedule from home, while also being there to guide their child through virtual school lessons, or being there to help their child at various periods of the day, get them set up, and then they can do a couple hours of work during the day. A lot of employers are having success with this hybrid model where it's understood the employee can't be at work in person, but rather than losing the employee entirely for 12 weeks, they're able to negotiate a hybrid where they're working and continuing to maintain some of their responsibilities. And the deal, yes, Jim.
Yeah, John, I just want to add a nuance to that while you're talking about that, because something we're talking to the DOL about right now is a case in this part about school being closed. And I know you're going to talk more about the hybrid and the impact on people in a minute about that. But for the sake of discussion, there's the two pieces, and it's the school is closed and daycare is not available. And then who's suitable, as you talked about. And from our earlier slides, we added the word suitable this time within there, because the debate at the DOL fact scenario is this: large employer says, we'll make childcare available at the facility. We'll hire people to take care of our employees' children if they're having trouble with daycare because of the hybrid model. The DOL originally, and they don't have a rule about this, the rules kind of suggest, back to what you were talking about, John, is that we can ask to say, what do you mean there's nobody available? You got to verify there's nobody available. And in this case, like I say, the large employer had childcare available, and the DOL initially was looking at to say, well, we're going to leave that to the employee's choice, whether it's suitable in their mind that they're comfortable with that childcare versus no childcare available, and stay home, take 2/3 pay, even though there's readily available good childcare. So that's a matter of debate right now at the DOL. We'll update everybody when we get an answer on that, hopefully within a day or two. And hopefully we convince them that that is suitable care back to the original verification and Q&As that the DOL has put out.
That's a really good point, and I think we're going to see more and more factual nuances arise as we get deeper into this issue, and specifically as we struggle with returning kids of all ages back to school. I think there's going to need to be a more detailed discussion about when is alternative child care available. I mean, you're hearing about parents who are entering into small cohorts to share and take turns being home with their children. So if you have an employee who is in that sort of agreement with their others in their neighborhood, and yes, their child is virtual, but they're only responsible for watching their child and the other children in the agreement 1 out of 5 days a week, well then suitable childcare is available the other 4 days of the week. I mean, would certainly be my argument, and I think would be consistent with the plain language of the DOL guidance. But the idea that we're limited to, or that the analysis is limited to, well, the school district where your child is enrolled or the daycare where your child was originally enrolled, I think that idea, as Jim just mentioned, is going to be stressed because we are seeing more alternative ways of addressing this child care need, which I think is one of the biggest hurdles that employers are facing when dealing with attendance. I mean, when the schools are closed, we've heard it talked about for months. When the schools are closed, it obviously impacts employees' ability to come to work, and then that in turn impacts employers' ability to run their business. So a great addition, and it is a nice foreshadowing of the hybrid model, which is another illustration of how the FFCRA is kind of being tested and forced to adopt a little bit, because now we don't have a traditional all in person or all at home. We're seeing these hybrid models, and we'll talk about how FFCRA applies to that. The last bullet point here is there is an FAQ in the DOL website about being able to ask for special circumstances of why you're needed for care for a child who's over the age of 14. It's been, frankly, in my experience, more of a discussion point in presentations and a review of the guidance than it is in actual practice. I haven't had an employer have to deal with an employee who wants off full-time because they have to care for a 17-year-old child and they haven't provided special circumstances. But if you're in a circumstance where the only child who needs care is over the age of 14, there is, as I said, guidance from the DOL that the employer can ask for additional information about the need to provide care. So the other key piece of the FFCRA leave is the Emergency Paid Sick Leave Act. And as I said, when we're talking about expanded FMLA, there's one qualifying event and one event only. The Emergency Paid Sick Leave Act is the multi-qualifying event. It has, I believe, 5 different ways that an employee can qualify. So this is the sick leave benefit that we're getting more questions on, at least in my experience, about eligibility. And this employee has symptoms and he was sent home. Is he eligible? We're going to talk about the specific events, but just know when you're talking about symptoms, when you're talking about quarantine, caring for family members, all of those events are in the realm of the Emergency Paid Sick Leave Act. So the benefit provides for 2 weeks of paid sick leave, and the amount of time available is calculated based on the number of hours the employee would typically work in a 2-week period. If the employee is full-time, that's obviously 80 hours. And if the employee is less than full-time, then again, it's based on what they would be normally scheduled to work during that period. There isn't an 80-hour benefit that a part-time employee can stretch over 4, 5, 6 weeks. It is a 2-week benefit, and the amount of paid leave is based on what the employee would have worked during that 2-week period. You're going to see there's one overlapping qualifying event there. In addition to the COVID-related reasons for absence, the need to provide childcare is also a qualifying event under emergency sick leave. So if that is the only reason that an employee is requesting leave, need to provide childcare, they do have the choice of using either their emergency paid sick leave or the expanded family medical leave. I wish it was easier. There always has to be an overlap and an interplay between benefits, and I distilled it down to one thing for you with EFMLA, and now I'm telling you that emergency paid sick leave is also in play. And employers, so there is under the FFCRA, for expanded family medical leave and emergency paid sick leave, both benefits, employers have the ability to opt out healthcare workers and emergency responders. And Jim's going to talk about a recent New York case that addressed the definition of healthcare provider under the FFCRA, specifically talked about the healthcare provider exemption designation and what that definition means and why that's significant. If you're an employer in the healthcare field or employing emergency responders, then hopefully you've gone through this analysis. If you don't have employees in either of those arenas, then this exception doesn't apply to you. But absolutely, if you're, again, servicing healthcare providers or working in the healthcare field, there may be the ability to exempt employees or certain employees from FFCRA eligibility. And then the exemption for employers with 50 or less employees, you can be exempted from certain aspects of the FFCRA, the obligation to provide paid leave, if you can show that providing the leave would jeopardize the viability of the business as a going concern. And again, this is one of those issues that was in the guidance. There is some guidance on what this means, what the standard is, what the protocol is for analyzing it and exercising this right. But in practice, I have seen very few employers actually go down this road or exercise it. And part of the reason is, I think, because the definition in my reading is fairly high. I mean, this is, I would argue, above the undue burden analysis that you'd see under the ADA. I mean, jeopardize the viability of the business as a going concern, I think on its face suggests that providing this leave would threaten your ability to continue doing business. So you have one employee in this very important role, and if they're gone, you cannot run your business. Or we have 6 employees and every person has a critical role, and if 3 of them go out on leave, we cannot run our business. It is not, again, based on the plain language, I do not think it would cover an employer who has to kind of scramble to cover, or it creates inconveniences or scheduling difficulties. So obviously there's a spectrum and there's a standard to be evaluated. If the application or administration of FFCRA is creating significant issues, it's out there for further discussion. But again, and Jim, correct me if I'm wrong, but in my experience over the last 6 months, I've seen few employers go too far down the road. So just to run through these quick, I know you've seen this list countless times over the last 6 months, but I want to emphasize the distinction between an employer policy that says, do not come to work if you're experiencing symptoms consistent with COVID-19. Tell us if you're having symptoms consistent with COVID-19, or tell us if you've been in contact with someone who has symptoms consistent with COVID-19. If you don't have a policy or if you haven't communicated that to your employees, you absolutely should. And if employees are reporting those issues to you and not being scheduled to work under your policy, again, because they have symptoms, because they've been in contact, and as a result, they're not being scheduled, that in and of itself does not trigger FFCRA eligibility. More specifically, it doesn't trigger eligibility for the emergency paid sick leave. If you look at the language in these qualifying events, each one of them requires an additional step, or at least a component of contact with a local, state, local, or federal healthcare professional or health department, or with a doctor. And just to illustrate what I'm talking about, number one, the employee is under a state, federal, or local quarantine or isolation order related to COVID-19. So where I've seen these is an employee has been contacted through contact tracing, based on the contact tracing, instructed by a local health department to not go into work or to self-isolate for a period of time. This can be, and this is substantiated and can be substantiated through documentation provided to that individual from the local health department. So if an employee represents to you that they've been instructed to do that, you can and should ask for documentation to substantiate that, and they should be able to provide that. The second one is the employee is advised by a healthcare provider to self-quarantine due to concerns related to COVID-19. Have seen this from healthcare providers for employees who are experiencing symptoms consistent with COVID. Have also seen it from healthcare providers when patients have an underlying condition that puts them at an increased risk. In both cases, and in order to be eligible under number two, again, it is advised by a healthcare provider. This can be substantiated by documentation, so as an employer, you absolutely should request that documentation to confirm that they qualify under number two. And then the last one, or the number three, excuse me, the employer is experiencing symptoms of COVID-19 and seeking a medical diagnosis. So this one is typically in play when an employer tells employees to stay home if they're experiencing symptoms. So the employee calls in, they report symptoms, the employer says, don't come in today, let's touch base in 3 days and see how you're feeling. If the employee sits home on their couch and doesn't seek a medical diagnosis, doesn't see a healthcare provider, and doesn't talk to a local health department and does nothing, then they are not eligible for emergency paid sick leave. However, if that employee over the course of that 3 days goes in, seeks a medical diagnosis, or goes and sees a healthcare provider, then they are likely eligible for FFCRA. And the amount of emergency paid sick leave and how long they're out, that analysis is entirely fact dependent, whether they have symptoms or contact, when was the contact, the extent of the contact. So how much leave is definitely fact specific, but if we're talking about the eligibility trigger, being sent home because you're experiencing symptoms is not the trigger. Seeking a medical diagnosis under number three is the trigger. So just to wrap up the FFCRA background, the emergency paid sick leave does include coverage for employees who are caring for other individuals or family members. Number 5 is the same event as the expanded family medical leave needed to provide care. Number 6 is just a catch-all that has remained largely undefined to date. And in my reading of the statute, it was a catch-all that was kind of reserved to be exercised but hasn't been exercised. So we really have no details and no administration of number 6. This is a good slide for you to refer to after the presentation. It walks through your evaluation checklist when someone applies or asks for FFCRA leave. It starts with an eligibility criteria for the employee and then goes into the qualifying event. And again, when evaluating the qualifying event, you should be simultaneously thinking about whether you're in the world of expanded family medical leave or emergency paid sick leave. If it's a child care issue, both potentially apply. And then finally, to go through quickly the hybrid school model and the impact that the FFCRA has on that. The issue can be distilled down to this slide, which is if the school district has an in-person instruction opportunity, the school district is not closed. So if the school district is all virtual, it's closed for purposes of FFCRA, and if the employee is needed to provide childcare, they're eligible. If the school district has a hybrid model where in-person instruction is available 2 or 3 days a week, the school is not closed on those days. And if the employee chooses to keep their kids all virtual in a district with a hybrid model, then on the days when in-person instruction is available to that student, the employee is not eligible for FFCRA leave. So Appleton, I believe, is now all virtual, but 3-4 weeks ago, we were looking at one day in school, 1 day out of school. I think 2 days a week we're in school, but there was an option for students to be 100% virtual. If a parent selected to go 100% virtual in Appleton's hybrid model 2 days a week, they would not be eligible for FFCRA leave because those 2 days, they're not needed to provide child care. The child could have gone into school. The school was open. So I know school districts and their models continue to evolve. Employees continue to evaluate the situation and may make the choice deeper into the school year to go all virtual, even though there are in-person instruction options available. Just be aware that if the school is open for in-person instruction on those days, the employee is not eligible for either expanded family medical leave or emergency paid sick leave to provide child care.
Sounds good, John. There's been a couple of questions that have come up as we've gone through this. When we're counting the number of people and we're gearing toward 50, something like that, the question is, are we limited to only full-time people? If I understand that correctly, it's no, that's not the case necessarily. We don't count just full-time people. Another question that we have has to do with figuring out this 80 hours of paid time, John, and the question is, is that if our full-time people, for example, work 37 and a half, do they get 40 hours under the paid time, or how do we figure that?
And correct me if I'm wrong, I know we talked about this in June timeframe when the guidance was first coming out, but I believe the DOL guidance is that it's what the employee would work in the 2 weeks. So in that example, it's the 37 and a half times 2, not the full 80.
That's exactly right. So it's full-time as defined by that employer. It's not a windfall of 40 when full-time really is only 37 and a half. So that is the reality of that. Another question we have, John, is I'm willing to do some telework. I'll allow my employee to do telework. I'm willing to have them, and the type of work that they do could be during any of the 24 hours. So if I can make that work available to them later in the day, some in the morning, some of the other time to get in there for the sake of discussion, 8 hours, is the employee then, can they then still take the lead to say, well, I don't like those hours and I got to care for my child?
Yeah, and that's fact-specific discussion analysis with the employee. What the issue is you're evaluating there is the employee unable to work? And they're telling me they have an 8th grader at home who's virtual learning, and I'm telling them I can make work available and you can do it at your discretion. And then the dialogue is back and forth. Well, if the employer insisting that, well, you can work midnight to 3 o'clock and get 3 hours in, obviously that's not a reasonable proposal. But if the employee is only needed to set up the lesson in the morning, deal with a lunch break, and then set up a lesson in the afternoon, I think there's a strong argument that they are available for telework and you are making telework available.
Yeah, and I agree. And I think the test in their discussions, at least so far with the DOL, it's a matter of reason. And the reality is most of the scenarios, the employees and the employer work together. Most of the employees want to work. It's the exception scenario that we see. So usually it works out. If it doesn't, I think you're right, John. I think it comes down to a matter of what's reasonable in that regard. So I'm just checking real quickly in terms of, I know there's some more questions and we'll come back to that a little bit. And we'll try to get to these at the end as far as that goes. One, yeah, in fact, we should probably, well, there's one other question here, John. Let me, as it talked about some of the stuff you referenced, was somebody that goes in for testing and the person's child care facility says, well, until you get the results back, you can't bring your children here. So which part of the leaves do they qualify for? And if I'm understanding the fact scenario, arguably they could qualify for both, because it's that one reason that fits both. The child care is unavailable, and if they can certify to that it's unavailable, they would get that. It also falls under the other reason, because as you said, you know, they're in for the testing. This isn't that they're staying at home and not doing anything, but once they're into the testing, then I think they could qualify for that as well, unless you think differently on that, John.
No, I think that's absolutely right. And and who is getting tested and why the person is out. So if there's a simultaneous employee out for their own testing, and as a result of that, their kid can't go to daycare, that you might say, well, 6 in one, half and dozen the other, they're out for expanded FMLA or emergency paid sick leave. It's important to distinguish, because under the emergency paid sick leave, the amount of the paid leave benefit is different. If the employee is out for their own health-related COVID absence, it's at 100%. If they're out for childcare, it's 2/3. So just being aware that that's in play when you're dealing with dual qualifying events.
Yeah, so let's come back to some questions and answers then later as we cover some of this, because some of it, as I see, we're going to cover in some of these slides. So then we'll see what's left as far as that goes. John had referenced that there was a case, and there was, and it's in the slide that's up in front of you. Oh, I should mention, because one of the questions, will the PowerPoint be made available? Yes, and so will this presentation. As I understand it, the chamber does video record these and then makes them available as a link to the chamber site. So all of that will be available for folks. But as we talk about the Southern District of New York case, this was back in April, they had challenged some of the DOL guidance that we've been talking about here. And there were 4 areas of concern that the court had, and they're listed. One of them had to do with the requirement that leaves available only to employee has work from which to take. They have work. The debate had to do as if somebody was on layoff and there really wasn't work, were they eligible for the leaves? And the DOL had said, no, you know, to be eligible for the leaves, you got to have these qualifying conditions, but there's got to be work available. That was one of the concerns, and the court had a problem with that part of it. I'm going to come down and address these a little bit in a second here. The second area of concern was about intermittent leave only under the traditional FMLA federal law. FMLA is available on intermittent leave if the employer approves, and that's the guidance the DOL stayed with under this law, under the expanded FMLA. There was a challenge to the definition of healthcare provider, and that there was also some challenges to the part about employee giving notice to the employer, and as the rules played through, it was prior notice prior to the leaves. So what happened with those things? John, if we go to the next slide with that, on the first one that I talked about, whether it applies when there's actual work available as opposed to a layoff, and the DOL looked at the court's decision and disagreed with the court, quite frankly. And the reason this is important is because we weren't sure, first of all, there was a little bit of a overreaction of folks to say, oh my God, there's this New York case and it applies across the country. Well, it doesn't. That's not the way the federal court system works necessarily. The second issue was, what's the agency going to do in enforcing this law? And this is what this is about, because they've come out with this new guidance and their answers to this court cases. So now we know what the Department of Labor is going to do about these 4 issues from the court out in New York, okay? So on this work available, they said, no, we're continuing our prior rule on that court. Good luck to you all in New York, but here's what we're going to be doing across the rest of the country in enforcement of that law. That's on point 1. So point 2 on the next one, about intermittent leave. They maintain their position again. That's that intermittent leave is only available. And again, this is the federal law aspect. Keep in mind that a couple week of state law things different. It's not what we're talking about necessarily today. Is upon employer's approval. There's also a lot of discussion in this new application of the regs, their updated temporary rule, which incidentally took effect yesterday. It came out last week. But in these hybrid situations, it's not intermittent leave. And it's interesting, just a week ago, I'm having this discussion with one of the examiners of the Department of Labor under these hybrid scenarios. And they were just in the process of getting their rules going. And they said they're not out yet, but we're not going to consider these hybrid models as intermittent leave. Every day of a school closure, if it's Monday, Wednesday, and Friday that it's closed, every day is going to consider, in their mind under the new regs, a new leave day, a new event, which is clever and interesting. I think it's a stretch, but that's their rule anyway, that's not intermittent leave. The next one had to do with talking about the definition of a healthcare provider. It doesn't apply to most of us here on the line. There are some, but they did revise their definition a little bit, and there was some concerns about how it interplayed with different regulations and different pieces, more than we need to know today as far as that one goes. There's a little amount of, if you're in that business, you'll want to tune into that a little bit more. The last one of issue, there were inconsistency as to giving notice. And what the bottom line is, they kind of went back to the way they applied the regular traditional FMLA, and as soon as practical. So it may not be that they give you notice the day they start to take it, which is always frustrating. It's always been frustrating under the traditional FMLA, but that's possible. And then there's some clarifications in the new regulations about that aspect of things. So that's the changes that went through those pieces of it. We still have the compliance process under FMLA, and we still have the accommodation obligation in terms of that. If you get the scenario, for example, and all of these same laws apply to that, but if you get the scenario that says, for example, I cannot wear a mask, and therefore, because of COVID issues, and I have a doctor's note that says that, we're going to have to look at walking through the interactive process and the other aspect of that to say, is there a reasonable accommodation to that? If you have a workplace rule, not necessarily talking about the governor's order, which may expire next week based on the timing of all of that, so stay tuned for all of that kind of stuff that'll happen with that. Put that aside, we'll deal with these different laws and accommodation aspects of things. I can only work at home, and I have a doctor's slip that says I can't come to the office. I can only work at home. That may put us into, again, the interactive process. If we go to the next slide or so, John, I'll just go through these pretty quick. And then the traditional accommodations aspect of what we're required to do with the interactive process and our need to respond to those kind of things. Like I say, the two quickest, the most common ones that we're seeing today is I need to work at home and I can't wear a mask. And yes, we have medical verification, some legitimate medical verification. John, I think you had one off the internet they were buying, isn't that right? Something like that.
Yeah, I think it was the Freedom to Breathe agency. They had made available some very impressive looking cards that said, I cannot wear a mask, and print this off and submit it to your employer, and they have to allow you to work without a mask. So that was one that a client received. Yeah.
Yeah, I like the ingenuity. The problem was they put in the logos, some of the federal government protected logos that got themselves into a little jam in terms of their creativity. And
yeah, the website got shut down, and the I forget which department they cited on their card, but they were pursuing legal action. So not only was it obviously not a valid medical document, it was illegal in ways.
Right. So if we go to the next slide in regards to that, again, our accommodations aspects, we're going to look, somebody says I can work full-time or I can't work full-time. Again, the intermittent leave and the new regulations or the clarification on regulations to that's going to come into play. Reduced, working at home, all of those kind of things. And those are the typical kind of things we're getting. I got to say though, and John, you know, in our experiences, we're working with people, there's really been 3 waves of reopenings. We had some of the private sector stuff reopening first. We had the municipal buildings, the county buildings, the municipal buildings second. Now we have the schools. Overall, it's been pretty good about people getting used to going back to work and doing the aspects of that. That's not to say we don't have the medical pieces of I can't do this or I can't do that, and that we've got to do the interactive conferences and some of that to work through it. It doesn't mean necessarily that somebody gets to work at home. Just to answer that question, the case law so far and through the 7th Circuit is work at home is really an exception, and that's not a widely accepted, necessarily required reasonable accommodation. We have had an administrative secretary position, a high-level administrative assistant position that wanted to work at home, and they needed that person doing lots of stuff at the office, critical to be at the office, and they could not reasonably accommodate the work at home scenario as far as that goes. The mask scenario, asthma, other pieces to that. We've had scenarios where people can't wear the mask. They're still able to come to work, but they're going to have to do all other aspects of things in terms of social distancing, washing, all the other requirements and other pieces in play to keep them safe and other people safe as far as that goes. Also had other scenarios where they can't wear the mask, and based on the close proximity of people and the nature of the work, that it could not be reasonably accommodated. So it's very fact specific in those kind of things. Why don't we go to the next slide then in regards to, well, we've already talked about the interactive process and the pieces that go with that. Again, the same thing kind of applies that we're dealing with the new requests under COVID that we used to deal with before. We go to the next slide in regards to this. Now let's spend a few minutes and then some questions over some of the kind of things, John, that you and I get. And if I take the first one, maybe is you get that I'm not comfortable coming to work, and therefore, why don't you just give me a leave of absence? And if you're really a good person, you'll keep me in full pay and benefit status, and wouldn't that all be good? Well, that isn't all good because there's no productivity and you got to have work done. And even if it's a scenario that I don't have work at home that I can do for the employee, this does not fall under the leaves that John was talking about later. This is not a protected reason or a qualifying reason to come into play as far as that goes. So, John, you want to work through these? You want to take the next one? Or you want to go back and forth?
Yeah, sure, that sounds good. So someone was in a vulnerable health or age group, they could get a note from their doctor that they should self-isolate or quarantine, which would entitle them to 2 weeks of emergency paid sick leave. But obviously that's a short-term remedy. Now they've exhausted that leave benefit, and there are other elements at play. If their condition qualifies them as disabled under the law, as that term is defined, then there's an interactive process. But if they're over the age of 60 and otherwise healthy and no known disabilities, then there may not be an ADA accommodation issue. So whether or not they qualify for protections under the ADA is a consideration. And just assuming for the sake of the question that you are engaged in the interactive process, like we talked about, and like with any interactive process, it's very closely tied to the facts, and the key facts being the essential functions of the employee's position. Are they able to be productive outside of the work office environment? And the other consideration is they're asking to work from home, but is there an alternative accommodation that would address their concerns, that would keep them safe, and would allow them to continue coming to work and performing work in the office? Can you put them in a separate office? Can you change their work hours so they're not interacting with other employees? Can you change the entry and access protocols for the building. There are certainly ways that you can significantly reduce exposure to other individuals if that is the primary concern. So I think that, as Jim has said, work from home, just because they're disabled or just they qualified as disabled or just because they're in a vulnerable population, they're not entitled by any stretch to that accommodation. There are certainly other factors to evaluate and consider.
Next one is, I tested positive. Let's talk about what happens in your workplace when this occurs and the different aspects of that. And then let's also talk about the tracing aspects of this, because it's very difficult in terms of leaves and how many people take leaves and then what do they qualify for that under the close contact rules. Let's go through some of the things about testing positive. First of all, there isn't any requirement under the law that the employer reports that to anybody. I'm not saying that you don't. I'm just saying, just to answer that, there's not. Generally, what does happen is the medical provider is required to report to the health agencies in regards to a positive test. The health agency then has tracers that talk to the employee that tested to say, okay, who have you had contact with and where, so that we can evaluate whether other people may have to quarantine. So then there's a discussion of, okay, who had close contact with this person and where. If that occurred in the workplace, then you're going to get contacted as the employer about looking at that tracing, and it might mean conversations with people that were in contact, and it may mean leaves. It does not mean, and it's very clear, that under the rules that we cannot say Jim Macy tested positive, everybody look out that's talked to Jim, or been in close contact with Jim. We can't name the name. We can say it could be the guy down in the corner office that talks really loud, so we all close our door and they'll all know it's Jim, but you can't say it's Jim. Okay, that's the rule. We don't make them up. We're just telling you what the rule is as far as that goes. So then there's the issue of close contact. And this is fairly controversial right now because the guidance, and I'm using the word guidance by design, not law, the guidance from the health agencies across the state are a little different than the State Department of Health and HSS. And is different a little bit than the CDC. Isn't that helpful? Now let's complicate it, because that's not complicated enough. They changed. 2 weeks ago, the guidance we had from the CDC on August 18th is different than it is, or several weeks ago, is different than it is today. We take a snapshot of the various guidance periodically because it changes, and we got to refer back to the advice given at the time based on the guidance that was out there. What does that all mean for you? Well, first of all, close contact means within 6 feet of people for 15 minutes or more, or physical contact like hugging, that type of thing. Spouses that stay together is close contact as far as that goes. The health agencies are going to look at that 6 feet and 15 minutes collectively. 5 minutes 3 times could be the 15. So we're back to a matter of what's within reason. What does that tell you? That tells you that your supervision of keeping people spread out matters, because if you have a positive test in your environment and you can assure that people have not been within the 6 feet and properly social distance, you aren't going to have 6-7 people going out on leave under the safety of the quarantine aspects of close contact from the health agencies. Okay, it's critical that you supervise that now, because that's where your biggest lead trail of people going out the door. Okay, so how long are they out for? Unfortunately, we all got together and celebrated John's birthday in the break room, and 10 of us are now awarded the ability to be out. Gosh, is it 10? Is it 14? Some health agencies will tell you, by God, close contact, it's 14 because it's not a test. If it's a test positive, it's 10. If it's not close contact, it's automatic 14. Once again, I can readily assure you that the guidance is not consistent throughout the different groups as far as all of that. That was the original guidance because we didn't have testing and other aspects. With testing that's come in play, the guidance has gone back and forth as to whether 2 tests over a certain time. Kind of like the game Twister. If you put your hand over here and you had a cough, but you didn't have a other respiratory problem, maybe it was this. Oh, it's just delightful. In any event, the bottom line, let's cut through all of that stuff. And when I step over the word guidance, the doctor's opinion is going to carry the day, because that all of the guidance, when I get through all of that, is that if a doctor says, I've analyzed the patient, I've tested, I'm aware of the guidance and following the guidance as well. If the doctor gives an opinion that the person can come back to work, they can come back to work. If the doctor says it's going to be 10 days, it's 10 days. And then we'll fall back into applying these different leaves. I know I cut through that pretty quick, but John, you want to add to that? Because it's so frustrating from our end, you know, and from an employer's end, because this stuff just keeps changing.
Yeah, no, that was a very good summary, and the takeaway is the facts control, and every change in the facts leads you down another level of analysis in a different area of the guidance. So there is no, unfortunately, 1 or even 2 clear responses to a positive test.
There's not, but there is an answer. There is a method. Method number 1 is absolutely supervised social distancing, because it matters under the tracing aspect. It's going to significantly limit your required quarantine leaves because of close contact. It's huge. It's just, from everything we're seeing practically, I can't emphasize that enough. Point number 2 is we're going to have to communicate with the doctors and ask people to see their doctors about it. The doctor's going to analyze the very specific fact situation as to say, is there a need to quarantine or not quarantine or not, based on those facts, symptoms, tests, and everything else that's available. I think we had a couple other things, John, on the next slide. Let's just see those for a second and see if we want to cover any of those. We've already talked about the close contact and communicating to people. What do we do about communicating? It's not a bad idea to let your workforce know if you had a positive test. We've had one in the environment, what we're doing about it. People are nervous about this and scared about this stuff. So communication's okay. We just don't name the person. We take steps to clean up areas and things like that. And we let people know what steps are being taken, and that people, if there were close contact in an area of concern, that they've been contacted and things like that. I put the last one on there. Would you just please lay me off so I can make more money? Yes, there are those scenarios that still, it's so frustrating. I can tell you something else. I have never been so frustrated with the Unemployment Compensation Division as I've seen now lately in employers now. They are way behind. I know you see this on the news all the time. I don't know what the problem is. It seems to us that they seem to grant all requests for unemployment comp, regardless of misconduct or other aspects. And I will tell you, yes, we've gone to hearing, and the judges have upheld some of that misconduct. And yes, I can tell you, we've gone to the Labor and Review Commission and overturned their judges, because they are just way across the line of just giving everything, because they're getting lots of money from the federal government, and think this is just fine. There'll be more about this down the road, because it's a problem. Any thoughts, John, or comments on any of that? But just a heads up to folks, if you're frustrated, you're in good company.
Yeah, no, I agree. Nothing further on unemployment. I just wanted to, in my closing remark, echo your comments about the proactive steps that employers can take to not only limit the contracting or contact tracing component, and as a result, the impact that a positive will have on your workforce, that's huge, but also the lawsuits that are likely to come a year or 18 months from now. The proactive steps are going to be huge in defending those. And the ones that we've talked about in earlier presentations is potential liability if someone gets sick at the workplace. The big question is going to be, what reasonable steps did the employer take to protect its employees? Challenges to refusal to accommodate. Someone wants to work from home, you go through the interactive process, you make an alternative proposal, and they don't like it, they don't take it, and then they challenge the decision. If you have a workplace where from April to now, you've increased sanitation protocols, you've addressed social distancing, you've implemented a mask policy, you have a very strong argument that you've exercised reasonable steps, that bringing the employee who claims they can only work from home isn't putting them in harm's way, that you did provide them with a reasonable alternative accommodation, you've given them a work environment that is safe and available for them to come and actually be productive in the workspace, in addition to all of those measures, addressing employee morale, addressing employee concerns, making them feel comfortable. We're talking a lot about the administration of benefits and kind of what happens when you have a positive case. But even on a day-to-day basis, when there's no cases, there's no contact, what you're doing in that proactive arena is really critically important.
Thanks, John. And let me finalize by saying I know there's a list of specific questions, some geared toward individual businesses that I'd like to deal with separately than this program. John and I have tried to cover the overview of the more general questions that would apply to everybody. As I'm looking at some of these as we finish, John, they really have to do with qualifying under those 6 different reasons. I can tell you when it comes to family members or responding to medical advice, whether it's a drive-in clinic or a specific doctor, if they're seeking advice for COVID testing and medical aspects, chances are they're going to qualify for the benefits because they're seeking medical information for that, or treating household members or caring for household members dealing with COVID-related things. Chances are the DOL is going to interpret pretty broadly the qualifying events for that. Again, we separated out under those other aspects we talked about, the things that are not. Bottom line is stay tuned. While we think, we could say this is the last program we're going to talk about COVID, it's not the last, because this is not ending. There are going to be changes. They say that some of these regs and laws are going to expire at the end of December. I'm not holding my breath. I'm not a betting man. I don't see that happening, that they're going to expire. They'll probably be extended. And the Lord knows what else will be coming. We'll stay on top of it. Chamber has asked us to be looking at programs about once a month and about this, second or third Thursday, John, I think you were thinking, and we think we'll put that online to keep people updated. So on behalf of John Iden and I certainly want to thank all of you for participating. John Casper, we turn it back to you.
Thank you, Jim. Thank you, John. Good program. Yes, we will be continuing. These are great. We get great response from our members listening in on these, and it's great information. This has been recorded. It'll be online on our website, so we'll get that information out to everybody if they want to go back and brief themselves again. Jim said COVID's probably going to be a topic for a while. I know I've understand that the city, the governor's order for mandated face masks is lifted on the 28th. However, I believe the city of Oshkosh, the mayor, is moving forward on a face mask ordinance citywide that would take us through the end of this year, December 31st. So we're certainly taking a close look at that. It looks very similar to what the state has enacted that we've been under for the last 2 months. So if anybody has any questions or issues about that, certainly reach out to us, and I'd certainly be interested in your thoughts on that. So with that, again, Jim Macy, John Eden, thank you very much for putting this program on again. And we are adjourned, and we'll get you back reconvene again next month on this topic. So thank you very much.
Thank you.